Hey girl, are you feeling confused about your PCOS diagnosis? Well, please know that you are not alone. PCOS comes in different types, called phenotypes, that can affect women in different ways. And did you know there are 4 different types of PCOS? Getting an accurate diagnosis of your specific PCOS phenotype is critical to developing an effective treatment plan. In this video, I'll break down the 4 PCOS phenotypes: classic, hyperandrogenic, non-classic, and anovulatory, to help you understand the unique symptoms and challenges of your type. I'll explain what each phenotype means for your hormones, periods, and fertility so you can start taking control of your health. Together, we'll explore lifestyle and nutrition changes tailored to your specific phenotype so that you can help manage your PCOS symptoms and so you can start feeling like yourself again. Don't worry, girlfriend, I've got your back on this PCOS journey. So let's dive in and figure out what your phenotype means for you. So let's talk about phenotype 1 first, which is called the classic type. If you've been diagnosed with phenotype 1, also known as the classic or type A PCOS, it means you present with all 3 Rotterdam criteria, which are hyperandrogenism or excess male hormones, oligoanovulation, also known as irregular periods, and polycystic ovaries. This is the most common type of the PCOS phenotypes and often results in symptoms like acne, excess facial or body hair, and difficulty getting pregnant. The good news is that lifestyle changes can significantly help manage this type. If this phenotype sounds like you want to focus on lifestyle changes like diet and exercise to help regulate your cycles and reduce symptoms. Your doctor may also prescribe medication to treat excess hair growth or regulate your periods. Let's move on now to phenotype number 2, which is hyperandrogenic PCOS. With phenotype 2 or type B PCOS, you have hyperandrogenism and anovulation, but not polycystic ovaries. You may struggle with acne, excess hair, or hair loss, and likely have abnormal menstrual cycles. So, you would have absent or irregular periods with excess androgens, but not have polycystic ovaries. Treatment focuses on managing symptoms like hirsutism, which is excess hair growth, through medication or procedures like laser hair removal. Making healthy lifestyle changes can also help prevent health issues down the road. Weight loss and exercise are especially helpful for this type of PCOS, as they can decrease male hormones and promote ovulation. Next up is phenotype number 3, non-classic PCOS. If you're diagnosed with phenotype 3 or type C PCOS, you have polycystic ovaries and hyperandrogenism, but continue to ovulate normally. Your symptoms may be primarily cosmetic, like acne or excess hair growth, though you remain at higher risk for health issues like diabetes or heart disease. You have excess androgens and polycystic ovaries, but you have normal periods. Treatment is aimed at controlling symptoms and preventing long-term problems. For this type, you want to focus on a balanced diet, regular exercise, reducing your stress through stress management, and losing excess weight, which can help lower your androgen levels. And here we are at phenotype number 4, anovulatory PCOS. With phenotype 4 or type D PCOS, you have polycystic ovaries and irregular or absent periods but normal androgen levels. You may struggle with fertility and higher health risks but have fewer cosmetic concerns. Losing excess weight and lifestyle changes can help restore ovulation and reduce health risks for this type. Treatment focuses on regulating your menstrual cycle through hormonal contraceptives or ovulation induction medication like Clomid. Lifestyle changes are also important for overall health and fertility. The specific diagnosis you receive depends on which of the Rotterdam criteria you meet, but the good news is PCOS is manageable no matter the type. Lifestyle changes and better nutrition can help get your hormones back in balance and reduce symptoms. The key is to not get overwhelmed. Work closely with your healthcare provider to determine your specific PCOS type and develop a tailored treatment plan. Making positive lifestyle changes and taking supplements as directed can help you get your symptoms under control and reduce your risk for other health issues. With the right diagnosis and treatment, you've got this, little lady. So now I'm going to talk about lifestyle changes and treatments that are tailor-made to your specific PCOS phenotype. The first one is diet and exercise, which has been shown to make a positive difference in all of the 4 phenotypes. No matter what your PCOS phenotype, improving your diet and exercise habits can help reduce symptoms. So you want to focus on complex carbohydrates, lean proteins, and healthy fats. You want to limit sugar and processed foods. For exercise, even light activity like walking, yoga, or strength training a few days a week can increase insulin sensitivity and improve ovulation. Now let's move on to specific lifestyle changes and treatments for phenotype 1, which remember is the classic most common type of PCOS, which means hyperandrogenetic, oligoanovulatory, and polycystic ovaries, or PCOM, which stands for polycystic ovary morphology. So if you have phenotype 1, medications like birth control pills or metformin may be recommended to regulate your cycle and androgen levels. Spironolactone, an androgen blocker, can reduce excess hair growth and acne, and then losing just 5 to 10% of your body weight through diet and lifestyle changes may be enough to restore ovulation. Now let's move on to treatments and lifestyle changes for phenotype 2. Phenotype 2 is hyperandrogenic and oligoanovulatory. Like phenotype 1, medications and lifestyle changes are typically first-line treatments. However, without polycystic ovaries or PCOM, weight loss may have an even bigger impact on ovulation and fertility. If needed, fertility drugs can be used to stimulate ovulation for women trying to conceive. For phenotype 3, which is PCOS with androgen excess and PCOM, but normal ovulation, anti-androgen medications may be recommended to manage symptoms like hirsutism, acne, and hair loss. Oral contraceptives can also help block androgens. Maintaining a healthy weight with a diet and exercise plan will minimize risk for metabolic issues down the road. And lastly, phenotype 4, which is anovulation and polycystic ovaries. With anovulation and PCOM as your primary concerns, ovulation induction with medications like clomiphene citrate or letrozole is typically recommended to improve fertility. Losing weight and following a PCOS-friendly lifestyle may be enough to naturally restore ovulation for some. Metformin may also be used to increase insulin sensitivity, which can improve the success of ovulation induction medications. So in summary, while PCOS symptoms may vary based on your phenotype, basic lifestyle improvements and targeted medical therapies for your specific needs can help manage symptoms, reduce health risks, and boost fertility. Discussing treatment options for your PCOS phenotype with your doctor or healthcare provider is key to finding what works best for your situation. So there you have it, ladies, the 4 main types of PCOS and what they mean for you. While it can feel overwhelming to get this diagnosis, remember that you are not alone. Millions of women worldwide have PCOS and are finding ways to manage it. Focus on making positive lifestyle changes, connect with your healthcare providers, and reach out to the PCOS community for support. You've got this. Small steps forward each day will lead to big improvements over time. Be patient and kind with yourself along the way, and know there is hope. You can take back control of your health, reduce those unpleasant symptoms, and start feeling like yourself again. And one last thing, ladies, a lot of women with PCOS struggle with food cravings. So if you have food cravings, then I want to let you know that I have a free online class where I teach you how to get rid of unhealthy food cravings for good without having to give up your favorite foods, even if you've struggled with unhealthy food cravings for many years. In the free online class, I teach you how to identify the root cause of your unhealthy food cravings and get rid of them for good. You'll also learn how to use my proven method to reduce and replace unhealthy food cravings so that you can get healthy again and lose weight quickly. So if you want to sign up for my free online class on food cravings, the link to this class is in the description box below. My name is Teresa. I'm a registered dietitian nutritionist and a health coach. And subscribe if you want to stay connected with me and see any new videos I post on nutrition, to learn how you can achieve your health and wellness goals for muscle gain and weight loss. And if you're a woman dealing with fertility issues, I also specialize in PCOS, endometriosis, and skin issues like acne. Thank you so much for watching, and I'll see you in my next video.